Good evening, everyone. Thank you for joining us tonight for this important conversation about COVID-19 vaccines for children. I'm Dr. Sterling Ransone. I'm a family physician in Deltaville, Virginia, and I have the privilege of serving as the president of the American Academy of Family Physicians. Joining me this evening to facilitate tonight's discussion is Dr. Lee Beers. She's a professor of pediatrics and the medical director for community health and advocacy at Children's National Hospital. Lee is also the current president of the American Academy of Pediatrics. Lee, it's great to see you again. I hope you're doing well.
Oh, thank you, Sterling. I am. I hope you're doing well as well. And it's really great to see you and wonderful to be here having this conversation with you and with all of our members. This is really a remarkable moment. We are finally at this moment that many pediatricians and family physicians have been eagerly waiting ever since a vaccine was first developed. 5 to 11-year-olds are now eligible to be immunized. But we know that the real work now begins to make sure every eligible family has access to the vaccine and can ask their trusted pediatrician or family physician all of their questions. But this is this is the work we do every day, and we're ready. From the beginning of the pandemic, all of you listening, pediatricians and family physicians, have been on the front lines fighting on behalf of your patients and communities. So I think first and most importantly, on behalf of Sterling and myself, we want to say thank you for all that you have done and continue to do to bring an end to this pandemic.
Well, yeah, I really appreciate you saying that. What all of our members have done for their patients and what they've endured as they try to educate our community on these important preventive health measures is just remarkable. I've been riding high since yesterday when ACIP unanimously approved everything. I just think this is fantastic. And it makes me feel like I did last December. Late last year, when the COVID vaccine, first came out, it provided this glimmer of hope that, we're getting and we can get towards the end of this pandemic. I remember the day really well. It was December 17th. It was the second day that the vaccine had been available for people. And I remember getting my vaccination, just feeling this sense of relief that, that we might be near the end of this. And it's just been incredible. And I think all of our members for both of our academies have done just such a fantastic job of getting the word out to our patients. It's really appreciated. As family physicians, some of us have been administering the COVID vaccine, ever since they were approved. I've been fortunate to be able to offer the vaccine from my office in rural Virginia. Now, I practice in a town that has about 1,000 people, and in our county, we've got about 9,000. But I work for a system, and our health system was very lucky that we thought ahead. We had one pharmacist who thought well ahead, and we were able to get super cold refrigeration so we could get the vaccine to our system early. So because we had signed up and we were early, we were able to get our communities safe and secure awfully early. I can tell you that since the announcement was made about the safety and efficacy of the vaccine for the 5 to 11-year-olds, our office phone has just been blowing up. We've had people who are calling and say, we want to be the first people to get this, have our children get this vaccine. I'm coming to you today from Kansas City. And, every time that we would stop, my wife, who's a pediatrician, and we practiced together, she would look at her email, and there was just tons of emails saying, when can I get the vaccine? And I think that, our patients are riding this wave too. They can't wait to get started and have their children be protected as well. So, I think that this is I'm just excited about the whole thing. Another important thing that we've been doing since day one of vaccines has been educating our patients and our communities about the safety and effectiveness of the COVID vaccines. And we hope that we can convince a lot of these people who might be a little skeptical to receive the vaccine. And we know that folks who are a little hesitant are much more likely to want to get the vaccine from the place where they receive their normal care. So, I think that, if we can talk, our parents of our patients about their concerns, they can go and encourage their friends and their families. And it's like that old Fabergé commercial where they told two friends and they told two friends, and the next thing you know, everybody knows. And it's great. So, I'm just really excited about being able to administer vaccines to my pediatric patients in this age range. So, the big thing that we're seeing right now is just a lot of misinformation, and this has been something that seeing adult patients as well. It's something we've been dealing with since the vaccines came out. With so much misinformation out there, and with the ability for little bits of misinformation to just explode due to social media, it really hasn't been an easy task for a lot of our members to add this to what they do on a daily basis. And that's one of the reasons I say thank you to you all, because I know how much effort that takes. And I know when I sit down, probably right now, about a quarter to a third of my office visit is discussing the vaccine, it's discussing the pandemic, and a lot of it is discussing misinformation that they've picked up online. So again, thank you to all of you. And I think this information, the getting the information about the vaccines out to our physicians is something that's probably the most important thing we're doing tonight, so that we can combat misinformation and we can continue to help our patients who are eligible to receive the vaccine.
Yeah. Oh gosh. I mean, thank you for pointing that out. And I mean, actually also just for really highlighting the great innovation that's happening in family physician offices and in pediatrician offices too, where, people are just coming together and really working together to make sure that our patients and our patients' families have access to the vaccination. And I think you're right that, this is something pediatricians have dealt, and I know family physicians too have dealt with for a long time, that many of the families we're caring for are confronted with a lot of inaccurate and misleading information about the vaccine and about the virus as well, and its impact on children. I think that's a very common misconception that COVID is not serious in children, but we know that it can be. Tragically, more than 600 children have died of COVID-19, and a disproportionate number of those kids have been Black and Latino children. And so, the inequities are really staggering. But no child should have to suffer or die from a vaccine preventable illness, especially now that we have a vaccine that's safe and effective. And I think, as soon as we've seen, when the vaccine was authorized for children ages 12 and up, I think what we're anticipating is that there will be an initial rush, followed by then a decline and leveling it off. And so our challenge is really going to be sustaining outreach, building momentum, reaching families who don't have easy access to the vaccine, and being available to counsel those with questions. You point out so much of the visit really that takes a lot of time, and it's really, really important work. So we have to make sure we help our pediatricians, our family physicians, get the things they need to have that time. And I know I speak for all of us on the call tonight when I say that we're just really eager and ready to offer all children ages 5 and up this protection. Like you, I've been hearing from lots of our members about the joy and relief they're feeling. Actually, lots of pediatricians, they were the first in line to get their kids the vaccine. I heard from one pediatrician where actually they opened up their appointments just a tiny bit early to offer the vaccine to their staff's patients, because it was so important to them, and they felt like it was really important to make sure that they prioritize their staff and their children in that way too. And then they opened up the clinic for all their patients. But it was really nice, and I think just spoke to how excited and committed pediatricians and family physicians are about this latest phase in the administration of the COVID vaccines. But we also know there's lots of questions from pediatricians and family physicians about lots of different things related to the vaccine for 5 to 11-year-olds, which is why we're really so pleased to have some guests with us tonight, and really pleased to introduce Drs. Bashara Coucher, Amanda Cohn, and Rachel Levine. We're going to give them each a few minutes to provide some updates before we have a discussion with everyone. So we're going to start with some introductions. I'll start and then pass the rest of the introductions over to you, Sterling. I have the distinct honor to introduce Admiral Rachel L. Levine, who is the Assistant Secretary for Health for the U.S. Department of Health and Human Services and the head of the U.S. Public Health Service Commission Corps. Previously, she was Pennsylvania's Physician General and later Pennsylvania's Secretary of Health. The title I am most proud to share for Admiral Levine out of all these impressive credentials, however, is she is a fellow pediatrician. So Admiral Levine, thank you so much for taking the time to be here with us this evening. And Sterling, I'm going to go back to you to let you introduce our other guests.
Thanks. So our second guest is Dr. Amanda Cohn. She currently serves as the Deputy Incidence Manager for Vaccines for the CDC COVID-19 emergency response. She's recently served as the Chief Medical Officer of the National Center for Immunizations and Respiratory Diseases, NCIRD, and the Executive Secretary of the Advisory Committee on Immunization Practices, or ACIP. Like Dr. Levine, Dr. Cohn is also a pediatrician. And last but not least, Dr. Shakir. Dr. Shakir is responsible for overseeing the national vaccination efforts under the Biden-Harris administration. He's been named White House COVID-19 Vaccinations Coordinator and focuses on coordinating the timely, safe, and equitable delivery of COVID-19 vaccinations for the entire U.S. population, in close partnership with relevant federal departments and agencies, as well as state and local authorities. Prior to joining the administration, Dr. Shakir served as Senior Vice President and Chief Health Officer at Kaiser Permanente. Before his time at Kaiser, Dr. Shakir was the Commissioner of the Chicago Department of Public Health for 5 years, before serving as Senior Vice President of Safety Net and Community Health at Trinity Health. He has also been named by Modern Healthcare as one of the 50 most influential health executives in the U.S., one of the most influential people in healthcare, and is one of the top 25 innovators in healthcare. Bushara, we will turn it over to you to get us started.
All right. Thank you, Sterling. Thank you, Lee, and Rachel and Amanda. I'm really looking forward to being with you tonight. And to everybody who's watching tonight, thank you, thank you, thank you. It's an honor to be with fellow family physicians and pediatricians. And a big thank you to you, Dr. Beers and Dr. Ransone, for all your work and your leadership. We're incredibly proud of the partnership we've had with the AAP and the AAFP for the last 10 months or so as we're fighting this pandemic. We're incredibly proud of your national leadership, the great work that's happening at a state level with your state chapters, but also with your members individually. I had the opportunity over the last few weeks to visit with 10 states in person. And in every one of these state visits that I've had, I had the opportunity to do roundtables with the chapters of the American Academy of Pediatrics and American Academy of Family Physicians. And I know many of the folks watching the event today are some of the people who I got a chance to have conversations with in person when I visited with those 10 states. And now I'm scheduling 10 virtual roundtable discussions with chapters across the country. And I've learned a ton about the amazing work you are doing on the front line, the sacrifices you're all making to making sure that we're getting this country vaccinated, and what you need from us to be able to support you even more in your work. So thank you for the input all along. I appreciate all what you've done to contribute to helping us put this pandemic behind us. And as a family physician myself, I'm humbled to be speaking to with all my fellow primary care docs today. So today obviously is a big day with the CDC recommending the Pfizer vaccine for 5 to 11-year-old last night. We know that vaccinations in some areas are starting as soon as today and will ramp up significantly in the coming days as millions and millions of doses continue to get shipped every day across the country. And as vaccine providers, including many of the pediatricians and family docs viewing this event, prepare to administer shots. So I won't go into a lot of the detail on the pediatric effort, as I know Dr. Levine and Dr. Cohn will cover this comprehensively, except on this. Family physician and pediatricians are critical to the success of this vaccination efforts. It goes without saying that parents rely on you more than anyone for accurate information and counseling about the vaccine, and for getting their kids vaccinated in your offices. And we're here to support you along the way with information, with messaging, with toolkits, with tips to enroll to vaccinate, you name it. So we're here to support you along the way. I'm going to cover a couple of quick topics before I'll turn over to Dr. Levine and Dr. Cohn. And let me start with just a brief update on the state of the pandemic. Our 7-day daily average of cases is now at about 75,000. It's down from 160,000 in early September. Our daily hospitalizations have gone down too, and now we're averaging about 5,100 per day. And our deaths is slightly down to about 1,100 or 1,200 per day. So the situation have been improving, although there has been a plateau in the last few days that we are tracking closely. So I want to be clear, we cannot get complacent. We have significant room for improvement as a country, and we have to keep getting more and more people vaccinated. Now, the good news is the vaccination trends are heading in the right direction. We've administered more than 425 million shots in this country. A major accomplishment that we couldn't have done without all of you. Over 80% of adults in this country have received at least one dose, and 70% are fully vaccinated. And that includes 85% of seniors fully vaccinated and about half of adolescents fully vaccinated. So we've made tons of progress, but we need to continue to build on that progress, especially amongst young people. And critical to doing so is primary care, including pediatrician and family physicians. The fact is, primary care providers are the single most trusted source of vaccine information, and your offices are the most preferred location for people to get vaccinated. Surveys have confirmed this time and again, and we know this to be intuitively true. I know a lot of primary care providers who are proactively reaching out to their patients who are unvaccinated and having conversations with them about getting a shot. You're asking your patients during your visits and having conversations with them, just like Lee has mentioned and Sterling has talked about, addressing their concerns and helping them make that informed decision. I know so many primary care docs are volunteering with their local media to be local vaccine ambassadors. You're being quoted, talking on TV, taking radio interviews. Your voices is beyond critical. And I know so many primary care providers administering vaccines in their offices. And if you're not already administering vaccines in your offices, I encourage you to do so. Nationally, we've seen more than doubling the number of practices, medical practices enrolled to administer vaccines over the last several months, and we have to continue to build on that momentum, particularly now with the vaccine for 5 to 11 being approved by the FDA and the CDC. So more on the peds from Dr. Cohn and Dr. Levine, but I do want to touch briefly on boosters. We've also we have now a booster program for all 3 vaccines that are available in the United States. So if you, for individual who received the Pfizer and Moderna second shot 6 months or more, they are eligible for a booster shot if they're 65 and older, 18 plus, but with an underlying medical condition, or 18 plus who work or live in high-risk settings. Now, for the nearly 15 million recipient of the J&J vaccine in this country, booster shots are also recommended for those who are 18 plus and who are vaccinated 2 or more months ago. And as you know by now, eligible individuals may choose which vaccine they receive as a booster dose, or what we call as the mix and match. And that booster program has also been up to a great start. We have gotten more than 20 million booster shots an arm already, and every single day we have hundreds of thousands of booster shots that are being administered. And then the final thing I would touch on is the importance of vaccine requirements. This is an essential component to reaching the unvaccinated, which continues to remain our top priority. We have encouraged and facilitated vaccine requirements for all U.S. government employees and contractors, healthcare workers, for companies with more than 100 employees. These vaccine requirements are going to cover about 100 million workers in the United States. And before these strategies were announced, it started with a lot of vaccine requirements happening at hospitals and healthcare providers that started this movement. So thank you for making that happen. So I know I'm reaching here my time before I'll have to turn over to Dr. Levine. Thank you for everything you do, and I look forward to the conversation and the Q&A. Rachel.
Well, thank you so much, Dr. Shakir. Appreciate all of your comments. So I'm very pleased to be here and really honored to be addressing you all. With COVID-19, it really has been and remains the biggest public health crisis that our country and the world has faced in over 100 years. We have certainly had a very difficult and challenging time over the last almost 2 years now. The COVID-19 pandemic has caused tremendous suffering for millions of Americans. And during the pandemic, we all have felt the strain. And I also want to thank you, our nation's pediatricians and family physicians on the front line, for all the tremendous work that you have done to serve our country during this very difficult time. One of the most pressing issues has been and is the impact that COVID-19 has had on our youth, both directly and indirectly. At the beginning, it seemed that children and adolescents might be less likely to be infected or have less severe illness early during the COVID-19 pandemic. But as the outbreak has progressed, larger numbers of children and adolescents have been and continue to become infected. And too many have been hospitalized and tragically passed away. So now we have safe and effective vaccines for children 5 to 11. And of course, we've had a vaccine available for children and teenagers 12 through 17. We know that vaccines work. As more people get vaccinated, the more cases and death rates fall. And this is just such an exciting moment. After 18 months of this pandemic, parents have really long awaited this day. We have a COVID-19 vaccine for children ages 5 to 11. We know this vaccine is safe. We know this vaccine is effective. It has undergone rigorous review. It has been authorized by the FDA and recommended by the CDC for children ages 5 to 11, and has been thoroughly tested for safety in thousands and thousands of children. So we have been planning and preparing for this moment for weeks and weeks, and we are ready to execute. On October 20th, the administration released its operational plan to ensure that vaccines for this age group are available, easy, and convenient. Under this plan, family physicians and pediatricians will really serve as the go-to source for COVID-19 vaccines and for accurate information about the COVID-19 vaccines. This plan ensures that we have the supply, we have the sites, and the support that is needed to get our nation's children vaccinated and protected against COVID-19. We have secured ample vaccine supply for our nation's children. As soon as the vaccine was authorized by the FDA, we started shipping millions of doses nationwide. 15 million doses have been made available to providers, jurisdictions, pharmacies, etc. And the shipments have already begun. States, tribes, and territories are working to ensure that doses are distributed efficiently and equitably across their jurisdictions. Over the past month, we have been planning with governors, pediatricians, pharmacies, community health centers, family physicians, and other vaccine providers. Parents will now be able to get their kids vaccinated through providers and in settings that they and their children know and trust. So with your help, with our pediatricians and primary care providers, more than 25,000 strong, have enrolled to administer vaccines, and we are working with states to enroll more. To ensure that parents have the information that they need to make informed choices for their families, HHS will conduct a national public education campaign to reach parents and guardians with accurate information about the vaccine and the risks that COVID-19 pose to children. We are partnering with you, the AAP, the AAFP, other doctors, educators, faith leaders, parents, and organizations to accomplish this. Now, one of the priorities is health equity. Equity needs to continue, and it will be at the center of our vaccination program. By sending vaccines to community health centers, working with children's hospitals to offer vaccination on nights and weekends, helping schools stand up vaccination clinics, and building vaccine confidence among parents, we will ensure that vaccines for kids ages 5 through 11 are easy, that they are convenient, and they are accessible to every family. So in closing, as family physicians and pediatricians, you all play an absolutely critical role in helping to end the pandemic. Again, more than 25,000 pediatricians and primary care providers have enrolled now to administer vaccines, and we're working with states to enroll more. To learn how you can become a COVID-19 vaccinator, please contact your state jurisdictions and visit the CDC website to learn about the steps vaccination providers must follow to participate in the COVID-19 vaccination program. You know, we all want to get through and past COVID-19. To really put this behind us, we need your help as trusted leaders to build confidence in COVID-19 vaccines and get even more of your patients and families vaccinated. That's the way we put COVID-19 behind us. Well, thank you so much, and I'm now going to turn things over to Dr. Cohn.
Good evening, everyone, and thank you, Admiral Levine. And it is such a pleasure to be here tonight with all of you. I am just getting emotional hearing about what we're about to embark on together to get kids vaccinated against COVID. Yesterday was one of the most impactful days of my experience on the COVID response at CDC and probably of my career, to hear the without reservation unanimous support of the Advisory Committee for Immunization Practices around not just the 28 million kids in this age group being eligible, but having a strong recommendation that supports that these vaccines are important to protect these children from COVID. The Braves also won last night, but I promise you that this is what was more exciting to me. So, as I said, there are about 28 million children between the ages of 5 and 11 in the United States. And there have been nearly 2 million cases of COVID in this age group since the pandemic started. I'm going to talk a little bit about the vaccine recommendations, a little bit more in depth about the Pfizer pediatric product, and provide some of the information around what made the AAP so supportive of this recommendation. So the pediatric studies, the pediatric Pfizer vaccine studies to support the EUA authorization by FDA included about 3,000 children who were vaccinated and monitored for safety post-vaccination. In these 3,000 children, there were no severe adverse events. There were normal, typical post-vaccine symptoms, including soreness at the site, headaches, muscle aches, and low-grade fevers, which were really common to the symptoms many of you, I'm sure, have experienced as well. Similar to what we saw in the adult trials, vaccination was nearly 91% effective at preventing COVID-19 among children 5 to 11 years of age. And the immunogenicity that these vaccines produced in this age group were very strong and robust and similar to the adult population. This is with a third of the dosage as the vaccine product that is used in adults. So while children are at a lower risk for becoming severely ill with COVID-19 compared to adults, children are infected with this virus, and there's no way to tell in advance if a child will get a severe or a mild case. So many of the kids who've been hospitalized and who have died from COVID do have underlying medical conditions, including obesity, but many do not. And so it's important to know that any child can be at risk for dying from what this is now is, as Lee said, a vaccine preventable disease. So we should not lose any child from a vaccine preventable disease, and we now can protect those down to age 9 years of age. This will also help prevent the rare but serious disease that's linked to COVID-19, MIS-C, and we are hopeful from some modeling studies that vaccination in this age group, it won't end the pandemic for sure, but it will help support reducing transmission in this in the United States. So I do want to just mention myocarditis, which is inflammation of the heart muscle, which has been reported following COVID-19 vaccination, especially in boys ages 16 to 18, but really in all boys under the age of 30. And this has been reported after the second dose. So myocarditis in this adolescent and young adult age group is rarely reported, but there is evidence to suggest that it is linked to the mRNA COVID-19 vaccines, including the Pfizer vaccine. As I said, most of these cases have occurred after the second dose. And what's really critical in being able to understand the balance and the benefits of the risks in these young children is that of the males, of the individuals who developed myocarditis within 7 days after vaccination, nearly all of them that have been followed up with have recovered. About 75% are completely back to normal within 30 days. And almost all of these symptoms are mild and require, and are self-limited and require little medical intervention. So this is this is something that we're watching for very closely in the 5 to 12-year-olds. If you look at the background rates of myocarditis in this age group compared to adolescent and young adults, it is much lower. So we are expecting, given the background rates as well as the lower dosage in this group of kids, that the side effect will be, well, that the adverse event will be reported at a much lower rate than what we're seeing in the adolescent and young adult males. But we're watching it very, very closely. And I think that is one of the most important things I want all of you to take away, is that we have one of the most robust safety systems this country has ever had for a new vaccine. And we have given over 400 million doses of COVID-19 vaccines, many which are for the Pfizer product. And so while we have about 3,000 kids in this age group who were tested prior to approval, we have a huge amount of safety data in adolescents and adults who have received the 30 microgram Pfizer vaccine. We will keep looking at these safety systems, not only VAERS, but also our active surveillance systems that check for a list of adverse events on a regular basis to make sure nothing is signaling or appearing. But what you can do for us, in addition to all you do by getting these kids vaccinated, is talk to parents and caregivers about enrolling in VSafe, which is the free smartphone-based tool that uses text messaging and web surveys that checks in on individuals. And I hope many of you did VSafe when you were vaccinated. Just for an example on how powerful of a tool this has been, both for individuals who are getting vaccinated, who report just an incredible amount of appreciation for getting checked in on daily shortly after vaccination. It's also given us, for example, we have over 850,000 people who are enrolled in VSafe who have gotten a third dose of vaccine. So it's an incredibly powerful tool. We want as many 5 to 11-year-olds who get vaccinated to enroll in VSafe, and so that we can monitor and ensure that these vaccines are safe during what we hope will be a very rapid uptake in this age group. I just want to conclude with one other piece of data, which is incredibly powerful to me, which has been hinted at, but parents who intend on vaccinating their kids range between about 50 and 60% in this country, which is similar to adolescent vaccine coverage, and we anticipate getting that. But the strongest indicator of whether or not a parent will vaccinate their child, besides whether or not that parent got vaccinated, is their healthcare provider, their pediatrician or family practitioner, telling them and recommending to get vaccinated. So I know many of you will have this vaccine in your clinic, and I am just so grateful that kids are able to go to their medical home to get these vaccines. I know many of you may not be able to support a vaccine clinic in your practice, and that is okay. What's most important is that you reach out to this age group in your practice and recommend that they get vaccinated, and know where children who are in your practice, if you're not giving vaccine, know where you can send them to get a vaccine. So I will turn it over to you, Lee and Sterling, who I think you'll have some questions for us, and we look forward to the discussion.
Great, thanks. And both Bashar and Amanda, you both talked about the importance of proactively reaching out to our patients. I can tell you in the adult experience in our office, that was something that was incredibly successful in getting people into the office. You know, in the early days of the vaccine administration, when we had a much more demand than we had supply, our patients absolutely loved it when we would call them and said, hey, you know, we had MedSaver syringes and we got an extra dose or occasionally two out of a vial. It's like, this is like, we've hit gold. And so we'd call them and say, hey, you know, you really need to come down and get this. And they really appreciate it. And I think this is an experience that we can move to our pediatric patients, because, you know, we assume that everybody knows what we know, that the vaccine is out there, that it's safe and effective, and that they're all waiting in line. But, you know, those of us in rural areas, those of us who take care of patients who are in underserved areas, they might not really know that, gosh, it's out there and it's now available in physician offices, and you can go to your family physician or pediatrician to get this. And I think that effort in proactively reaching out to our patients will be incredibly important to get folks to come in and get this, so we can help save lives. So anyways, we know that family physicians and pediatricians across the country are excited to be able to immunize this 5 to 11 year age range. Lee and I have gathered some questions from amongst our colleagues that we'd like to ask y'all. And we're also going to ask each other a few questions too. So Lee, you're up first.
All right. Well, thank you so much. And I think maybe I will start with the first question, Bashar, Dr. Shakir, for you. And actually, Admiral Levine talked about this a little bit, but I think one of the things that we're hearing a lot from pediatricians, and Sterling, I'm sure you're hearing this from family physicians too, is just, you know, what are the details? How much more are we going to get? When are we going to get it? What can we expect? And so, you know, can you share any more details about what we can expect over the next couple of weeks? I think there's been this first initial rollout, but what can we expect over the next couple of weeks as the vaccine rollout continues? And if you could talk a little bit more, again, Admiral Levine, I know talked about this some, but how primary care physicians will be able to really make sure we continue to be able to access the vaccine for our patients.
Yeah, thank you, Lee. So let me just start by saying that we have secured enough vaccines to vaccinate all 28 million kids in this country, ages 5 to 11. And for weeks now, we have been working with states, with local health department, with doctors, hospitals, with community health centers, with pharmacies, to make sure that we have the operating plan. So as soon as the vaccine was authorized by the FDA, within minutes, we were literally packing and shipping the vaccines to tens of thousands of locations across the country. And millions of doses are being shipped. And again, I'm seeing at the comments section, many physicians have already said, oh, we've administered 10 shots today. We opened the first vial, or we're got the vaccine. We're planning the vaccine clinic on Friday. So I think we're going to start seeing some vaccinations happening later this week. But I think the program will be up to its full speed the week of November 8th. Now, the other thing I'd want to mention is, you know, from day one, I've engaged with the AAFP and the AAP, who've been active and ready to engage with us. They've been engaging, you've been engaging with the CDC on what can we do to make it easier for docs to be able to apply and enroll to become vaccinators in their offices and receive the vaccines in their offices. And the CDC has done a tremendous job working with so many practices across the country. We've actually nearly doubled the number of medical practices that are enrolled and receiving the vaccine over the last few months. We continue to do this work at a national level with the AAP, AAFP, who are also doing this at a state level. You know, we continue to host roundtable discussions, encourage calls like this to encourage physicians to enroll. There are lots of resources to support practices to enroll. We want to continue to do that. The other thing I'd mention is providers who are already enrolled in the VFC program, the Vaccine for Children program. We can continue to focus on enrolling those folks to make sure that every one of the VFC provider is also enrolled in the vaccine, the COVID-19 vaccine program. And Amanda, myself, and others at the CDC, and I know the AAP chapters and the AAFP chapters, we've been hosting roundtable discussions, we've been talking to each other, we've been encouraging each other. So we'd want to need to continue to do that to get more and more enrollment. We have plenty of vaccines We'd want to do everything we can to get those vaccines right into your practices, and we're happy to support you along the way. The other thing I'd mention is something that Amanda mentioned, which is if you end up not administering the vaccine in your offices, just that conversation with your patients, with their parents, to encourage them to get the vaccine and know where you can send them to get the vaccine is going to be so critical.
Great, thanks. And I apologize. I mumbled while you were speaking because my computer flashed that it was getting ready to go to sleep because my battery was running out. So that was, a few more little hairs just popped off the head here. So sorry about that one. But we're plugged in and we're ready to go. So that's technology is great, isn't it? So, a couple things, but I think I'll move on to my next question. My next question is for Amanda. So for Dr. Cohn. Could you tell us what changes were made for the dosing, administration, and formulation of the 5 to 11 vaccine for COVID versus the adult, ones that we're giving for ages 12 and over?
Sure. So it's actually really important to distinguish between the pediatric dose and the adult dose. The pediatric dose will come with an orange cap, and the adult dose will come with a purple cap. So we call the pediatric vaccine the orange cap vaccine. The dosage for the pediatric dose is 10 micrograms compared to 30 micrograms. So it's a third of the dose. But in terms of the volume that you're giving, you give 0.2 cc's for the pediatric dose, and you give 0.3 cc's of the adult dose. So the reason for this is because this is a different concentration of product. And the formulation uses a tris sucrose buffer, which is a different buffer than the buffer that is used for the adult product, which is phosphate buffered saline. So it's important to know that you have to use the orange cap for pediatrics. You also have to use the diluent that accompanies the pediatric product that you get. And when you get your product, you should also come with the ancillary supplies and the kits that are particularly put together for the pediatric age group. The best thing about the pediatric formulation is that it is also refrigerator stable up to 10 weeks. So pediatricians and family practitioners, for the most part, can just put the vaccine right in their refrigerators and hopefully use all of those doses during that time. You can order at a quantity. The first week or two, you can only order a quantity of 300 doses. So for those of you who got doses early, you got about 300 doses. But in starting, I believe it's November 9th or that week, you will be able to order doses in the 100 dose quantity. And so that's really important in terms of expanding access and allowing even primary care providers who live in more rural areas and don't have as high of enough children in this age group to continue to vaccinate in their practice. I get a lot of questions about second doses. These second doses are also given 21 days apart. We don't want people to save those second doses. I think if you did the adult rollout, you were told to sort of half your supply and use them for the first dose and the second dose. We anticipate there will be a consistent supply of pediatric vaccine over the coming weeks, and that there is enough product to vaccinate any child who wants to get it with 2 doses. And so you can go ahead and use your supply. Be mindful of when you're getting new doses coming in, but go ahead and vaccinate.
Great, thanks. And when we got those little orange capped vaccine vials, we got our 300 doses in yesterday. It was an exciting thing for us to have. And I got some questions from some folks who they aren't family physicians and they aren't pediatricians, and they're like, well, how can you know what you're doing with these vaccines? It's different from the adult one. Can you do that? I just kind of looked at them. And so I sat and I went down the list of, for a family physician, what vaccines do I give out for adults? For adults only, there are 10 different vaccines ranging from a Tdap to Gardasil that we give folks. They're all different. And on our pediatric side, there are 13 different vaccines. Lee, you know how many vaccines we give out in our offices. We can keep all of them straight. And then in our state, we also have to keep our pediatric vaccines for one insurance separate from the others. You know, for our Vaccines for Children program, our Medicaid program, they have to be accounted for totally separately. So we're dealing with all these different vaccines. It's what we do in our office. And we really appreciate that the federal government has gotten this vaccine out into the offices so we can take care of our patients where they want to be taken care of. So thanks for that. So next, I'm going to jump over and I've got a question for Lee. Okay. So my question for you, Lee, is, so the flu season's coming up on us, and we need for many children to get caught up on missed vaccinations for things that, you know, that they didn't do during the pandemic when people were isolated and things. Will co-administration of this vaccine continue to be recommended for the 5 to 11 age group? And how do we deal with some of the catch-up issues and COVID vaccinations at the same time?
Yeah, well, thank you for that. That's an incredibly important question, and I can answer it really briefly, which is yes, you can co-administer vaccines, and it's very much encouraged, right? I think it has been a hard time for families, and the more we can help increase their access to care and minimize barriers, the better. And so I know, you know, in my own practice at Children's, we often, you know, we kind of call it like no wrong door, right? Whenever you come into us, we're going to look at your vaccine records and see if you are behind or due for anything, and work to get it to you right at that point. So yeah, so absolutely can co-administer, and we encourage that. You know, and I will then actually ask my next question to Admiral Levine. I think this is actually something that I know you and the administration really have been thinking quite a bit about, but can you talk to us a little bit about how the administration is addressing misinformation and vaccine hesitancy, and specifically for children and their caregivers, though of course we know that it spans the lifespan?
Well, thank you, Dr. Beers, for that question. It's a very important issue. You know, we know that there are many families that are eagerly awaiting the opportunity to get vaccinated, but there's also families with questions. As we've seen with adults, confidence grows with time. At the start of the vaccination program, about 34% of adults were eager to get the shot. Today, 80% of adults have at least their first shot. So, you know, we want to work with trusted messengers in the community, such as you all, such as the community's family physicians and pediatricians and nurses and faith leaders and others to answer questions. And so we've worked to build partnerships, for example, with your organizations, the AAP and the AAFP, as well as the Children's Hospital Association. We're going to come out with a full range of earned media and paid media to build confidence. We want to coordinate our efforts. It's very important with state and local health departments and their campaigns. In terms of misinformation, the Surgeon General has been working to address this and has information and monograph about misinformation. And so we all need to work against that so we can provide these safe and effective vaccines to our children and their families.
Oh, great. Thank you very much. And we, as you know, we at the AAP and AAFP value our relationship with you and are willing to work with you in all sorts of ways to help combat misinformation and hesitancy. So we're honored to do so. So Sterling, I get to ask you a question now. As a follow-up from that, you know, one of the things that combats bad information is good information. So can you share some specific resources that might aid some of our physicians in counseling parents and caregivers?
Absolutely. And I think both of our academies have done a great job in getting information out and accessible to our patients. For the AAFP, we've actually got two different sites that you can go to. AAFP.org/COVID vaccine, one word, is a great source of frequent. We've got an FAQ part where we address a lot of myths for this age group. I mean, probably the biggest one is the fertility myth, that it will affect fertility. I know I've gotten a lot of that in the office. I don't want to give my kid the vaccine because they're worried that, you know, they won't have grandchildren after this or something. So, you know, we've got an FAQ part. Again, that's AAFP.org/COVID vaccine. We also have familydoctor.org/vaccines. And we've got a lot of information that's tailored towards the community that can get to the bottom of a lot of the misinformation that they'll see on social media and things like that. And I know that you guys at the AAP have a great site that's AAP.org/COVID. And I know that's live. We've gone there and taken a look, and it's a lot of great resources that parents can use to answer some questions that they might have before they vaccinate their kids. So those are the ones that we have right now. So to move things along, because I realize we're running a little short on time, I've got a question for Dr. Cohn, and that's basically this is another practical question. So we know that, you know, a lot of children, you know, with the holidays coming up for Thanksgiving or Christmas, the New Year's, the winter holidays, that, you know, if they're traveling and they're due their second dose, you know, what do you do? We'd really hate to see people say, well, I'm not going to get my first dose because in 3 weeks I'm going to be in, you know, where grandpa is, and they miss that opportunity. What's the recommendation about folks when they're traveling, and how are we going to work the second dose of the vaccine?
Yeah, so the strong recommendation is to go ahead and get your first dose of vaccine, regardless of whether or not you're traveling at that 3-week interval. Importantly, 3 weeks is, you know, the first time you can get that second dose, but it's okay if you get it at 4 or 5 weeks. You get some protection from the first dose, and you're fully protected after that second dose, which is why we want kids to get it within that 3-week interval. But you can, you know, my recommendation would be, if you're traveling, to get your dose right when you return back, if you left before that 3-week interval. And I say that because I do think it's important from an immunization registry perspective and from a documentation perspective to have your doses given in the same state. Now, if you're traveling in the same state, it really shouldn't matter. Your doses should be documented appropriately anywhere. But I just think for easeability, to get those doses in the IIS, so you can so everyone knows, you know, it's in your record. And so I think that's one of the primary reasons I would recommend, if you're returning within a couple of weeks after that 3-week period, to schedule your next dose for when you get back.
Great, thank you.
Well, I have the honor of asking the last question, and you know, it's the authorization of the vaccine for 5 to 11-year-olds is so remarkable. But I know I'm already getting asked by families, and I know all of you are too. So, Dr. Shakir, could you tell us what do you think the timeline is going to be for children under 5? Everyone's going to want to know.
Well, I wish I have a crystal ball for that one. I think we're going to have to wait for the data to come out. We have to wait for those trials. And we have a really gold standard process in place between the FDA process, the CDC process, that people should feel very confident with a process that's open, that's transparent, that's public, that's data-driven, that's science-driven. So I'm not going to speculate here. I'm not going to get ahead of the CDC and the FDA, but I can tell you we have 28 million kids 5 to 11 who are eligible today to get vaccinated. So let's make sure we get them vaccinated. We still have half of 12 to 17-year-olds who are eligible. We want to get them vaccinated. And we still have about 20% of adults to get vaccinated. So I feel like we have a lot of work ahead of us. We have to remain focused on making sure that we're vaccinating the unvaccinated, and that's an important part of the job. We have to make sure that those who are eligible for boosters are getting their boosters, so we're optimizing the protection that we're getting from this vaccine. And of course, the new chapter with the 5 to 11, just a wonderful journey. So a lot of work. The data, whenever the data comes out, we have great processes in place with the FDA and the CDC. So let's wait patiently for that, and we have lots of work until then.
Great. Well, I think that's about all we have time for the night. So thank you so much to all of you for your wisdom and for helping us all answer questions we might have about administration of the vaccine for our 5 to 11-year-olds. So on behalf of the AAFP and the AAP, and for all of our members, Lee and I would like to thank each of you again for spending your evening with us with this information. I know both of our academies have places on our websites where you can go to get more information. It's scrolling across the bottom of the screen. So please feel free to go, and I think a lot of your questions will be answered there. So to all of you who joined us this evening, thank you very much for being with us. Thanks for everything that you do for your patients, and thank you for everything you do for your community in helping us get to the end of this pandemic. Thanks again, and everyone have a great night.
Thank you, everybody.
Good night.